Hi, my name is Haley. I am a shift manager on the Medical Oncology floor at Phelps Health. I've been working as a nurse for 2 years. I've always really been interested in the healthcare field, but when I was growing up, there was a girl in my church who was diagnosed with leukemia. Hearing her story and how the nurses impacted her hospital stay, impacted her just experience going through leukemia, and her parents just really inspired me to be able to work with oncology patients and to make a real difference in people's lives. What I most like about nursing is there's like two things. One is being able to educate my patients. A lot of times on our floor we get new COPD patients with a new diagnosis of cancer, diabetes, and just being able to educate them and be able to see them grow. So coming in, a lot of times we get patients with COPD, diabetes, new oncology diagnoses, and them coming in from the ER really scared and anxious, and then a couple of days later being able to understand what's going on and seeing them grow is a huge thing. I really look forward to going in and seeing those growths in the patients. Being able to provide nursing interventions, being able to see how antibiotics can really see a change in patients, really seeing by getting patients out of the bed and into the chair and watching them be able to get stronger. Those types of things really inspire me to go to work every day because I really get to see the changes. Like when you work shifts like 3 to 5 days in a row, you really do see the progression in the care, and that is so fulfilling for me. So on our floor, we had part of it blocked off. So one wing, 18 beds were just COVID beds. And for the past 2 years, that hallway's been open, closed, and at most we would have every single bed closed with COVID patients. And those COVID patients were really sick. A lot of the nurses on our floor say that we were a step down ICU because we would have patients on maxed out Vapotherm, maxed out BiPAP, and just really, really sick. And that took a toll on myself, a lot of my coworkers. We really had to lean onto each other for help. It was exhausting, but it was also rewarding to see some of those patients actually get better. So going back to what we were talking about with COVID, that was a very, very challenging time. Like I was saying, that our patients were really, really sick. I would have to care for 4 very sick patients at one time, and trying to get all their needs met while trying to take care of other people was very difficult. Having to transfer people to the ICU almost every day and just seeing these patients deteriorate, that was very, very, very hard and very difficult. But something that was really rewarding is we did have a patient on our floor. He was on the floor for 40 days, and just to see how sick he was, to like leaving, walking out of the hospital, like what a miracle, and something to be thankful for, and to be proud that our floor worked together and was able to get him better and out the door walking is just really rewarding. And just hearing his thanks and his appreciation for our hard work and everyone coming together to see him get better was really rewarding. So nursing school is hard, but the profession of nursing is so, so rewarding. So if you just get through those hard years to get your degree, nursing is just so rewarding. Phelps Health is a really good organization to work with. I moved here last year to be with my husband who's in the military. I had choices of some other hospitals in the area. I really like the location of Phelps. I like the community. The Medical Oncology floor is a great place to work. I have some really great coworkers. I talked about earlier teamwork. We have a lot of teamwork on our floor. Our PCAs, our nurses, we work really well together. We try and complement each other's strengths, and I really admire that.